Welcome to the January issue of Diseases of the Colon and Rectum. I'd like to wish you all a very happy new year. In this month's issue of the journal on the website, you'll find the articles for this month's journal club, which is devoted to the topic of colon cancer. And as usual, the articles will be free for access, and there also will be listed questions to stimulate discussion. This month in the journal, our Residents' Corner is devoted to the topic of anastomotic leak after colonic resection. It's written by Drs. Chitone and Hill, and the expert commentary is by Dr. Mantai. In this month's issue, you'll also find a clinical practice guideline. It's devoted to the topic of bowel preparation in elective colon and rectal surgery. We have quite a few editor picks this month. We will start off with low anterior resection syndrome and quality of life after sphincter sparing rectal cancer surgery, a long-term longitudinal follow-up study. And this is a multi-institutional study, both from Stockholm, Sweden, as well as Aarhus University Hospital and Randers Hospital in Denmark. And in this study, the authors wanted to find out whether the low anterior resection syndrome changes over time and is correlated to the quality of life when measured at two different time points after surgery, measured 5 years apart. This multi-center study looked at nearly 300 patients, and they found out that at the second follow-up, nearly half of the patients still experienced major impairment. So this is a very well-done long-term follow-up study, I think, of interest to us all. Our next study is entitled A Changing Spectrum of Colon Cancer Biology with Age, Implications for the Young Patient. And this is by Dr. Chauhan and colleagues at Cleveland Clinic. And in this study, the authors postulated that CPG island hypermethylation and BRAF mutations account for about a quarter of colorectal cancers. And because these cancers tend to be right-sided and because DNA hypermethylation increases with age, they postulated there would be an increasing number of these right-sided cancers over time. And conversely, they would expect young patients to have fewer of these methylated and right-sided cancers. So they looked at nearly 500 cancers in their own database and examined them, and they basically found that no young cancers were hypermethylated, compared with 22% of cancers of patients aged greater than 50 years. So again, a very interesting study looking at these features in their patients. Our next editor pick is entitled A Decision Analysis for Rectal Sparing Familial Adenomatous Polyposis, Total Colectomy with Ileorectal Anastomosis versus Proctocolectomy with Ileopouch Anal Anastomosis. And this is by Drs. Melnichuk and colleagues from Brigham and Women's Hospital in Boston. And this is accompanied by an excellent editorial by Dr. Malou. And in this study, the authors postulated that there were different approaches for the surgical management of rectal sparing polyposis, and they wanted to do quantify trade-offs between these two operations using a decision analysis method. And they basically defined rectal sparing as having 0 to 20 polyps in the rectum that could easily be moved using endoscopic means. And using their analysis, they had identified that in the majority of cases, ileorectal anastomosis had a improved quality adjusted life years compared with IPAA. And they for this reason, it was preferable for patients. And in the excellent editorial, Dr. Malou states, again, reservations about the techniques and used and studies utilized for this. Our next editor pick is entitled Laparoscopic Ventral Rectopexy versus Stapled Transanal Rectal Resection for the Treatment of Obstructed Defecation in the Elderly, a long-term results of a prospective randomized study. This is by Drs. Madbouli and Mohi from the University of Alexandria in Egypt. And in this study, the authors wanted to compare long-term functional outcome, recurrence rate, and quality of life between laparoscopic ventral rectopexy and staple transanal rectal resection in the treatment of obstructed defecation. And here they excluded non-relaxing puborectalis in patients who had previous abdominal surgery. Patients were randomly allocated to either laparoscopic ventral rectopexy or staple transanal rectal resection, 56 patients to each arm. And they basically found that both techniques were safe. However, ventral rectopexy had better long-term functional outcome with fewer complications, less recurrences, and better compared with transanal rectal resection, and perineal descent only improved after ventral rectopexy. Our next editor pick is entitled Contributions of Internal Intussusception, Irritable Bowel Syndrome, and Pelvic Floor Dyssynergia to Obstructed Defecation Syndrome. And this is by Drs. Cavallaro and colleagues from Massachusetts General Hospital. And in this study, the authors wanted to characterize constipation in patients with obstructive defecation syndrome and identify whether internal intussusception or other diagnoses such as IBS contributed to symptoms. And they basically examined over 300 consecutive patients with defecography who had completed a constipation severity instrument. And they basically found that IBS was associated with a significant increase in constipation score and obstructed defecation subscale score. And on multivariate regression, they found that IBS and dyssynergia were both associated with a significant increase in obstructed defecation subscale scores. And their conclusion of their study was that any patient who was referred for surgical management of obstructed defecation should be screened and treated for IBS and dyssynergia before considering surgical management. So again, I think a very important paper. Our next editor pick and our next two editor picks actually focus both on comparison of surgical outcomes after emergency surgery between colorectal surgeons and general surgeons. This one is entitled The Effect of Surgical Training, an Operative Approach on Outcomes in Acute Diverticulitis. Should guidelines be revisited? And this is by Dr. Goldstone and colleagues at Massachusetts General Hospital. And in this study, the authors wanted to compare the effect of operative approach and surgeon training on outcomes following emergent colectomy for diverticulitis. Here they used the New York all-payer sample from 2000 to 2014, and specifically they wanted to compare the outcome following a segmental resection, primary anastomosis, and proximal diversion. And here they basically found out that on multivariable regression, adjusting for patient demographics, year of operation, hospital academic status, as well as surgeon training, primary anastomosis with proximal diversion was associated with an increased mortality, increased complications, and increased rate of reoperation. And colorectal board certification was associated with decreased mortality. But they stated that given that the majority of operations were performed by non-colorectal surgeons, they questioned whether or not our guidelines for operation in these patients should be revisited. Our last editor pick is entitled Emergent Colon Resections. Does a surgeon specialization influence outcomes? And this is by Drs. Kulayat and colleagues from Pennsylvania State University at Hershey, Columbia University in New York, as well as Temple University in Philadelphia. And again, similar to the last study, here the authors wanted to compare the outcomes from surgery done by general surgeons as well as that done by colorectal surgeons in patients undergoing emergency surgery. Here they wanted to use the NSQIP database. They looked at 3 tertiary care hospitals, and here they looked at nearly 900 patients. They used a propensity score method, and here they found that cases performed by colorectal surgeons were associated with significantly lower rates of 30-day mortality, lower postoperative morbidity, and lower rates of unplanned major reoperation, as well as shorter hospital stays. We have a lot of other very good articles in this month's issue, and we hope to see you again next month. Thank you.